But we help, and it's nice to be able to understand this new, technology with this medication, peptide, and how it does help. It's not free in terms of cover it, but I thought somewhat, so if you were to have, for example, for me, I would have my knee surgery, right? I had to pay for the doctor, the anesthesiologist, the surgery center, the labs, and still comes out. That still comes out to about $5,000-$6,000. Your deductible. It still comes out to that. Now, don't forget the rehab and to fix that, then and lost work time. You think about all that. People think, oh my God, it's expensive. But if you think of the alternative, get the quality of life just financially, it makes more sense.
Welcome to the Medical Entrepreneur Podcast. We have a very special guest with us today. We have Dr. Jeffrey Steinberg. He's a very accomplished neurologist who treats NFL athletes, neurodegenerative disorders, headaches, traumatic brain injury, multiple sclerosis, sleep disorders, and pain in Plantation, Florida. Dr. Steinberg, thank you so much for coming on the podcast today.
You're welcome. It's so nice to meet you and to help people and talk with you about this.
Man, thank you so much. We're really excited today because I understand that you are also using some PDPA technology to treat your patients, but you yourself use the technology on yourself to basically improve your knee. Is that correct?
Oh yeah, it's a typical story. I played hockey my whole life, blew out my knee in high school, and then about 93. So that when I was in residency, I probably had to tell the grass, and so I could function, used its knee brace when I went skiing, playing hockey. And as I got older, I said, okay, maybe I'll need a knee brace, put on my quads, and just kept going along. And finally, in the past couple of years, my knee just would always swell. I'd walk up and down a few blocks and my knee would swell up. And I would get it drained and I get better, take some Steinberg, anti-inflammatories, therapy. It's very frustrating. And in fact, in the last 2 years, I kept getting my knee drained because we were trying to prevent surgery. The last time it was 28 cc's of fluid.
Whoa.
That's a lot.
That is a lot.
Yeah. I mean, compared to what, the normal, how much do you think is in the normal amount of fluid in the knee?
Well, I just did the calculation for the conversion. 28 cc's is 5.6 teaspoons.
Wow.
That's huge, considering a teaspoon is like a large dose of liquid medication, right? It's like more than 5.5 of those.
Yeah, and every few months I was doing it. I did it 3 times.
Wow.
And even after that, my knee would still hurt. And I just started riding my bicycle for my exercise, low impact, get outdoors. And it would still, at the end, I have to ice it and the next day, hit my anti-inflammatories and just maybe feel tight the next day, try to go to chiropractor or therapy, use my tendon. And I'm like, me as a doctor, and I know the risks of surgeries, right? We all know the benefits and risks. And the next option was partial knee replacement. And I was like, I was going to bite the bullet. It's like, I'm still young, I'm active, I'm healthy, and I said, and then, I'd done stem cells in the past. I don't know if you knew that. I'd done stem cells and PRP before COVID for the same purpose. Mm-hmm. And I got good response. It was not like great, but I was more functional, didn't swell up, it was less symptomatic.
Yeah.
But didn't last long. Not at all. I was like, frustrated. I'm like, I'm going to have to have the surgery. I was so pissed.
That's what I saw a lot with the regenerative products beforehand. Like, PRP was somewhat useful. But the effects were somewhat mild. And then a lot of the other products, like, when they were, allowed by the FDA, like the umbilical cord stuff, the Warden's jelly, these things, they offered some benefit, but it's very rare to have anybody have long-term results. Like, it was more like, hey, we'll give you, partial symptomatic relief,
I did the research too. We're both in the medical field, so we had a little bit more of an edge in terms of understanding, really going into the details of what a medicine could do. So I said, well, that's, and then again, surgery. I actually went to an orthopod who did surgery for Miami Heat. This was before I did the other products. He told me to do a full knee replacement.
Yeah,
he told me that.
I wouldn't be surprised.
I was like, I won't say it, F you, but can you imagine that? But it was his alternatives. That's what they know. Sometimes people have to realize, I give the analogy, when you go to a butcher, he's going to tell you to eat meat. He's got the best vegetables in the world. but his best product, what he knows and what he sells, is me. So he will tell you that with the vegetable diet.
Yeah.
You may not, but then that's the analogy they're telling patient. Plus you cannot do surgery. That's the other number one factor. So I did a lot of research and I said, same thing you did. I go, well, mild, consistent is better than nothing.
Absolutely. And I think a lot of people also forget, what I tell patients is like the first two steps of a knee replacement are amputation. And so, for step one, you got to do the upper amputation. Step two, you got to do lower amputation. That's before you even get into the actual replacement part, right? So once that's done, there's just no going back, Now you're stuck with artificial prosthetic knee. You can switch them out, but you have to do something,
And you realize too that when you talk about the knee or another major joint, whether it's the hip, it affects the other parts of the body. Anyone who's played sports knows that it's one unit. So if your lumbar spine is malaligned, if your hips are jointed, if your knees displaced, if your ankle's torn, it affects every other part of your body. So if you have surgery and they don't correct the other parts of the other joints are going to be affected too.
And then would you maybe be able to kind of walk us through like how you were doing before the treatment with the PDPA and then we walk through the treatment for the PDPA and then how you did afterwards too?
I can tell you as a doctor, and being a patient, I am raising the balloons, the flags, the stars. I can't tell you how much better it is. It's night and day. I went to I had the injection, about a month after the injection, I went to the Super Bowl week. And you know how anyone who's been in Vegas, you walk up and down steps and walking miles. Now, my knee didn't swell once. I didn't take one anti-inflammatory. And to this day, I'm riding my bicycle. I'm playing pickleball.
Whoa.
Dude, I'll ice down a little bit, but who shouldn't, in Africa, shouldn't do. Rarely I'll get a little bit of swell edema. I find it interesting though. I don't know if you're experienced, but I have a little bit of edema. If I exercise a little bit more, it goes away. So I think it's the compartmentalized of the tissue, of the fluid. So it just dissipates. I don't know if your other patients have noticed that or seen that. I've
also seen that in myself, that a lot of times, particularly if I don't keep a consistent level of exercise, I'll notice that joints are more likely to swell, even on myself and also on patients as well. And I think a lot of it is we forget just, how important our, venous system is. And venous system, of course, has no way to pump its own blood. And then, our whole, lymphatic system, I think that's why, if you look at the data and it shows if someone walks twice a day, I think it's for 30 minutes twice a day, the risk of heart attack, stroke, drops by 80%. I think a lot of it is just because we have our circulatory system that needs to pump, that needs to move. And, if we're sitting in a chair all day, it's not doing that. So.
As a side of what, whether I see that for painful peripheral neuropathy from diabetes, I tell them to get a foot massager, but I have to tell you, as a patient and understanding the pathophysiology of this product, I can tell you that my knee was unstable when I hyperextended. And I'm sure a lot of people who have knee injuries can relate to this, that I would hyperextend my knee up and just almost get it back in place, and you feel that pop, you go, feels better. And if I correlated on the x-rays, it shows that my fibula was mildly displaced because of all the laxity of my ligaments and my joints and the amount of fluid in there. So it adds some more prestige. After I had the medication, it's normalized. It's back in place. My knee is back in alignment, and so is my fibula, the small little bone next to the knee. That's back in alignment. It just amazes me. As doctors, we don't get amazed a lot. Right?
It's true.
I am amazed. I am amazed. And even on my MRI, prior to the study, it showed that my posterior cruciate was buckling because of all of what I just described. And that's now stabilized, which explains why my knee doesn't pop. It helped correct some of the malformation that was due to the wear and tear of my knee.
Man, that's incredible. And just the fact that you got results so quickly, do you find that this product is useful for basically delivering such you have a patient that needs to get results quickly?
Oh, absolutely. I think the only thing I tell people is, from what I read, is that if you're a little bit older, it may take a little bit longer for it to get into the application. And then we say, hey, look, I'm pretty sure this is a miracle cure. but be patient. Sometimes it happens overnight. It may take a week, and it may not be immediate, 90%. I was getting about 90% better, and it's in several, it's been much longer than, I'll have you as long as it's been. But, I think you have to tell people, as much as it's going to be miracle, be patient, and it takes time, but you also doesn't mean that in and of itself, that's it. You still have to go back to a healthy routine. I'm still exercising, I'm stretching. So in and of itself allows you to get back to do what you should be doing healthy. And I think that's an important part of the puzzle. Don't assume that in and of itself it's going to be the cure.
That's a very good point. The PDPA technology can regenerate tissue, but it doesn't like make you immune from having to do, your normal workout, etc. Well, I guess the last time, just to kind of make sure that everybody understands who's listening, basically you had these severe knee issues, and I have your old MRI pulled up here on the screen that we're going to, but you can see here in the video. And basically it does show that you had a chronic tear of the ACL. And then you had osteoarthritis, most pronounced in the medial component, where you had chondromalacia and degenerative tear of the medial meniscus. You had a complete tear of the posterior horn of the lateral meniscus, and a whole bunch of joint effusion and synovitis, along with a Baker's cyst too. So kind of translating that to normal English, in case you're not a medical person, basically a pretty decent osteoarthritis with a lot of swelling and a couple tears of some ligaments, including the ACL and also the MCL, or the lateral horn of the medial meniscus. So this is like a pretty
pretty
messed up.
Sure. Another orthopedic surgeon, not the ones who wanted me to get knee replacement. Just put it from there. It's Dr. Doctor knows. You got to test up knee. You want Jeff, he goes, I don't want to tell you, but you got a bad knee.
And so you got the injection. It was around January, mid-January when you got the PDPA injection. And then today it's basically May 18th right now. So basically in these, after the injection, you had benefit within what time frame you think?
3 years, 3 to 5 days.
Wow.
3 days I started noticing. 3 days I started noticing a little improvement. I would say by 7 days. But as I said, Super Bowl week was first week of February. And that's when I was started celebrating. Because I've been to Vegas before with this knee. And I was like taking a break, stop, take the anti-inflammatory before I go. My girlfriend at the time would massage my knee. And I was a restless sleeper. I get text something else today, and as we're talking, I couldn't sleep when my knee swells up like that. And I can relate because I'm a sleep specialist. I ask my patients, I could not sleep well when my knee was inflamed like that. It's just not comfortable. The edema, you can't find it, but I was sleeping well. I still sleep well. My knee does not bother me. It does not, which now gives me a little bit more energy to go on with my life. And I'm now more motivated to do my exercises, stretch, right? How many times do we say that? Right? I do that,
True.
and I can do it because I see the results. It allows me to be healthy again, to go on and do what I want to do with my life. Because as we all know, it's functionality. My knee is never going to be normal, but it's better. And, there's still going to be deterioration, but it's like I push the cause back,
Yeah.
It's like I'm not doing surgery. And if I do healthy activities and do it smartly, can now avoid a protection or, maybe a second shot. But isn't that worth money? Isn't that worth quality of life? I mean, I've had a lot of people, I've had patients that his wife has really bad dementia, Alzheimer's. And we were talking about the cost and the benefits. He said, I can just keep her where she's at. And he's the caregiver. She's dependent and he needs a lot of help, to take care of her. I just want to be able to her enjoy herself where she's at rather than deal with her. I don't want her to get worse. That's worth everything. Because she's still intact mentally to the extent that she recognizes and I can be with them. And they can still have a social interaction. He said, what's that worth to me? It goes everything.
That's so true.
Yeah. And I had another, the first patient I did, he's 80 years old, at 80, and he's still plays pickleball. He wins championships.
Whoa.
He's 50, he won pickleball championships against, and when he was 8, even up 5 to 10 years ago, he guys in his 50s playing pickleball.
Wow.
And all of a sudden, because of arthritis in the cervical spine at multiple levels, he developed a pinched nerve radiculopathy, C6 radiculopathy. So pinched nerve going down here into his hands. And his left hand was numbness. His right hand was pain. And he couldn't do anything. He became depressed because that was his life. He enjoyed that. Was his release. That's the fight.
Yeah, probably a social interaction too.
Yeah. And I just we did other things for him and it just didn't get where he wanted to go. And on top of that, his family began to notice that he was stuttering. This guy's an accountant, right? So does accounting. So his stuttering really was a fact of him having word finding difficulties. He started to develop a little bit of what called GI, mild cognitive impairment. So I did MRIs on him. I did an EEG. EEG is like an EKG. It shows a rhythm and rate of R of the brain. So it's very similar. It was slightly slow for his age. His neuropsychology test showed he was a little bit depressed, a little bit of memory loss. So, but it's a little bit more than what you expect for someone that age. So I discussed all this with him, and he decided that I recommended that he do two sessions, one for true cervical spine and one intravenously for his cognitive deficit. Then first few days, nothing happened. Getting a little bit worried. He's getting anxious, following out. By about the 7th, 8th day, he noticed an improvement, and it's gone. So his radiculopathy is gone. His sensory exam, I did a nerve study test on it. It's normalized.
Wow.
So now they're like, he has pain. He has trigger finger now. So that's his, so he has a trigger finger. We're dealing with that physically. And I may even inject that depending how he responds to traditional therapy.
Yeah.
And they can grip. And he's not stuttering anymore.
Wow. So
he's talking fluently, he's sharp, and obviously as a result of these two things, he's not depressed. So I haven't done the formal reevaluation of his cognitive issue. And it'll be really interesting because, and I'd like to do a follow-up with you. I did an amyloid PET scan on it, which is abnormal. Showed a lot of amyloid plaques, which is typical of Alzheimer's. So I just did this. So I'm going to see in about 3 months, 6 months, we'll repeat the amyloid PET scan. See how that goes. But his radiculopathy is already gone.
Wow. So, and what about his word finding? Is that better as well?
Oh yeah, it doesn't stutter. He's coherent. He's interactive. You can tell. I mean, I've done informal testing, and his cognition has improved.
Absolutely. And for some
objectively as well as subjective.
And for some people that are watching or listening, and maybe they don't know the medical terminology, basically he had the radiculopathy is basically when the nerves are being pinched in the cervical spine, and so he had weakness in his arms, I imagine. Plus, was he dropping things or?
Well, it was just more numbness and couldn't hold on. So, sometimes people think it's carpal tunnel pinched nerve, right? Here's just a pinched nerve in the neck from chronic arthritis. The gentleman's 80-some years old, so. But he's still physically active, so. And pinched nerve was coming from bone joint, irritating that nerve outstone. And it was getting worse. He had numbness on one side, pain on the other. So it was bilateral on both sides. So, but by injecting them into the cassette, it resolved it.
Man, that's amazing.
And he's happy, and he's, back to playing pickleball. Besides, the trigger point, which is, keeps the traction, so it's really tight in here. So he said, you know what? Yes, we should take you in here too.
You could.
So quite information. But first I want to use traditional therapy to see if that goes away. And then if not out, then he's what to do.
Absolutely.
So, but again, people, big thing with memory loss, Alzheimer's, I tell people, you don't wait to have a heart attack to treat heart disease. You don't wait to have dementia, which it's memory loss. Alzheimer's is the most common form of dementia. Don't wait to have dementia to treat it. So obviously there's nutrition, exercise, eat healthy. But if you're noticing, go to a neurologist and you're evaluated and it's happening, this medicine the studies showing that it does work. It does. And the other press thing is about brain injuries. That's all about inflammation. And this product is, as you realize, and, people who are listening should know, treats the inflammation. And I think that's really powerful, helpful, treatment option. Because there's not a treatment option for TBI. There is for traumatic brain injury. We just treat the symptoms, the problems related to the traumatic brain injury, but there's nothing to correct it. And that's the power of this.
Yeah. I think you're really 100% right. And I feel like this is going to end up being like a whole new chapter in medicine for a lot of people because, or maybe we should ask you, like, when you look at the changes in tissue, I'm not sure if you try this yet, where you've done like a methylation test on someone's tissue and then you treat them with the PDPA technology and then later do another methylation test and you see the methylation has decreased, which is like the biological age. Is there, have you seen any kind of like, or how do you feel that that effect is like helping people, or do you feel that's like regenerating the tissue?
Well, that's the whole point, right? There's actually studies out in Japan and some in the States where they've actually seen that reversal. So the tissue inflammation, glial cells, they're all inflamed. And what this has done is actually reduce that inflammation. So with the traumatic brain injury, it's usually a static, injury. So they got hit multiple times. By the time they see me, the damage is there. Right. So they're not getting hit anymore. So therefore, if you can reverse that inflammation, you should be able to theoretically it won't progress. Whereas I think with Alzheimer's, you're still building up that plaque formation. And that's the debate whether it's going to stop that plaque formation. So therefore, it doesn't decay, or is it just an ongoing process and we just, again, shifted it back and therefore you may need repeated treatments.
Absolutely.
And perhaps just studies going to be out about that. But I think for the TBI, traumatic brain injury, I think we're going to see a huge impact. And these are young people.
Yeah.
These are young people who have problems with severe migraines, balance problems, memory problems. So they have, migraines, which are the 6th most disabling disease in the world, over a person's lifetime. The prevalence of that's tremendous. Highly problems like someone who has dementia, so treating them like an Alzheimer's. I mean, you have 45, 55-year-old people who can't pick up their kids because they forgot. They have to pick up their kids, and how stressful that is to the caregiver.
Yeah.
And then there's balance problems. So they feel like they're going to fall. And it's like anyone who's been drunk. It's that sort of feeling. It can risk falling. They have Parkinson-like symptoms, tremors, handwriting. So you can see it affects all spheres of your quality of life, neurologically. So to be able to reverse that, or at least, stop the process so they can still have a functional life is tremendous. And the studies have shown that. That's what's exciting about this, isn't it?
It is. It's amazing. There's so many people out there that need help with cognitive function that have, long COVID, that have brain fog. And I put these in quotes because they're kind of catch-alls for a lot of different illnesses. And one thing I'll tell you is, like, Dr. Steinberg, I think more people need to be aware of you because there's not a lot of people that are stepping up to solve these problems in a holistic way. And mainstream medicine, to be quite honest, it's kind of like a pill mill. You're going to get some kind of, a lot of times what I've seen on the other side, as a physician who has referred people to neurologists is like, they'll go for a headache or something and they'll get pill after pill after pill after pill, and they keep trying different meds. And while that is one solution to help cover up the symptoms, very rarely do you see anybody like actually trying to solve the issue. And I've been so impressed by you and your practice because you actually get down to like what is actually causing the issue and how can we actually stop this? How can we actually reverse it rather than just cover up with this med.
Yeah, the first thing I do, you do this too. I mean, we see a lot of overlap patients where they call fibromyalgia. Now we call it encephalomyelitis. Fibromyalgia is like people would say, "Oh, so you're faking it." It's in a catch-all phrase. So now they say encephalomyelitis. Encephalon means brain, myelitis, inflammation. It's fine, right? In the muscle. So now it's encephalomyelitis. But now long haulers, you're right. People acknowledge long hauler syndrome. But for years, we see people who, there are obviously some psychological issues to some people with fibro, but a lot of people are legitimately hurt or and physiologically affected, but they never acknowledged it. But now that long haulers, now they acknowledge it. So, but to me, like I said, I get people off the soda. I cannot stand to. I tell people that they ban, artificial sweeteners in England because it kills rats. And here in the States, we just said, well, we're not sure if it causes cancer, so it's okay. So England cares more about their rats than the FDA cares about their people.
Yeah.
And I tell people to get off coffee, to get off artificial creamers. So before I even give them a medicine, I give them vitamins, nutrients. I know there's, you're involved with one of the nutrients products that are phenomenal, and it's healthy. I tell people, read the label. Anything that said to start, throw out.
So true. So true. And it's banned in almost every country in Europe. And yet, and it's not just that. There's several chemicals like that. And we actually had an interview with this lady. Her name was Zen Honeycutt. She runs a little nonprofit called Moms Across America. This lady's like just a real trooper. She raised, I think, like 30 grand. And then with that, took that 30K, ended up testing all the fast food places and all the school lunches for like, to see like what was in them. And they all came back really high, positive for glyphosate. The lowest fast food place, interesting enough, was Chipotle, by the way. Even some of my favorite restaurants, like I had to stop eating that, because of the data. So just be aware when I see it. But it really opened my eyes to how many toxins people are encountering every day that we're just not, really recognizing, because it's been kind of somewhat swept under the rug by mainstream media. Mainstream media never talks about this stuff. But and he was even showing that sometimes they had levels of different drugs and heavy metals, even in the meats and stuff of like school lunches for children. It was very shocking. So I think you're exactly right.
Who determines how much mercury or how much lead is acceptable? I looked it up. Quest and MedCorp, they're the ones who decided. But I mean, as you know, and you do this too, it takes time to talk to these people and explain it to them. And doctors and government enforcement get paid to do that. And either they're not educated or they don't have desire or the effort. And when I do all my migraines, I get them off. And I tell them it takes 6 weeks to detox after coffee if they drink too much coffee. I go, think about that. How long it is to have that effect. Statins, big time. I see the generic cholesterol lowering pills, tons of side effects. But I said 6 weeks, mostly 6 weeks will not affect your cholesterol management. I really getting frustrated when the other doctor might can't go up. 6 weeks is not going to affect your cholesterol management, right? But 6 weeks will pay you into side effect. And I tell people, with back pain that we both see, I go, go bowling and carry a 13-pound bowling ball. If you throw it, how about walking around with that now for every day of your life? That's what you're doing. You wonder why your knees and your back hurt, So before you take a pill, sometimes a pill can help you to get better. To like with my experience, if it's peptides help me to maintain a better lifestyle. So I can exercise.
Yeah.
And now that's the idea what this product can do. It can allow you to get back to being you. And I understand some people can't sleep well, they not pain, and they just can't function. So this can allow them to jumpstart, but it's part and parcel with good health.
Well, one thing I really wanted to ask you about, which I think is a huge area of medicine that's underserved, is just the headache community. And you mentioned earlier the statistic, which is so true, is that how prevalent disability is from migraines. I mean, it is like, huge. Like most people don't even realize how large it is. Is it, one of the things that I thought was really great is just how you have this holistic approach to migraines. And while you do sometimes, integrate like some of the more advanced like PDP technology, could you maybe talk to listeners who are, other medical professionals who, have just only been instructed on like, hey, the only thing I know how to do is prescribe, medications. So, when somebody comes to migraine, I'm going to write a Triptan or whatever, like maybe, is there any way that you could describe your approach? Because I feel like it's very unique and it helps a lot of patients.
Well, it should be unique. It's time intensive. It really is. I always say, I would like to write a chapter in a book saying, ask the next question. Right? Well, I would show you, I had a lady today or not today, but last week. I had a lady today. I said, I had a patient this week who my medical assistant had interviewed and said, oh, she drinks 1 cup of coffee. So I said, 1 cup of coffee, what do you add? What do you have with it? I go, you only have 1 cup? What kind of coffee? Well, she goes, well, in the office, the staff make Cuban coffees. So I had it done a couple times a week. And I had my own cup of coffee in the morning. And whoa. Oh, I go, do you have energy drinks too? Oh yeah, I have a cup of love. So next thing you know, she's having all these chemicals and all the stimulants. And then the last question is, Well, why? Are you tired? Is it because you like it? And then they say you're tired. So now I got to tell them, why are they tired? Is it a medical condition, stressful thing? That takes time. And the next thing I know, maybe they have a sleep problem now. So maybe, so now I have to tell them to get off their coffee. So they have to explain to why. That's right there. It took us 5 minutes just to tell them that part.
Yeah.
You don't have that much. So it's not really so much rocket science, but nutrition. I mean, alpha lipoic acid, glutamate, and a glutathione. There's a lot of nutrients that people are not getting it. There's a product that you know very well. It has a lot of this substances in it, and it does help. As opposed to drinking carbonated drink, having the healthy, the complex fluid, having an energy drink that really has proteins in it, that has vitamin supplements, not, the chemicals when you go to, get a shake and they're loaded with sugar. And then they wonder why they call it an energy drink.
Exactly. And then also the energy drinks that people buy like at the gas station, if you ever really look into those, I mean, oh man, they're between I remember, I think it was Rockstar Energy was one of the first energy drinks, and it was known for the fact that I think it was like fluorescent, like the liquid itself, like you could shine a light on it, it would fluoresce. And so it was like, well, what are you drinking? What are you drinking that for? And I remember I had one patient that was actually a truck driver. And so he was drinking 10 of these energy drinks a day. And, he came to see me and for some pain issues in his neck and his arms. And then, I was asking him like how he's doing, and went ahead and like did an EKG of him. Of course, his heart rate's like really rapid, right? We saw that on like our vitals. And I just asked him like, hey, can you just cut down on these energy drinks? And he's like, yeah, they just taste so good. So I just drink one after another after another. And then once we were able to cut that down, like everything went away. His pain in his neck did, his tachycardia went away. Just like he was just getting too much stimulation, and God knows about the side effects of whatever these, these vitamins they put in there.
But and to your point, like what is the peptides that we're injecting these patients while we're doing it? We're getting rid of inflammation. But what is this inflammation caused by? Sometimes it's physiological, and we're here to help them medically. But a lot of time it's if they induce it themselves, like you said, it's allergens, these drinks that people are taking, and they don't know any better. So, but that's inflammation. So as you said, just cutting out the energy drink, his pain went away. It's what I go, people, inflammation, people, you have to think differently. I said, people look at it, they look at their stomach or their brain and go, it's your whole body, your immune system is fighting off inflammation, and you're creating that inflammation. Obesity is inflammation, right? We all know that, but we really don't talk about that. Parkinson's is some inflammation. Multiple sclerosis is post-viral syndrome. Right? How many times in your practice you said it's a post-viral? What does that mean? Long hauler syndrome. Inflammation. This medication helps bring out inflammation, but they can help themselves. I think with MS, I mean, we're sort of getting there with genetics and stuff, and the biologics. We're getting to that as well, and which is not necessarily medicine, but sort of where peptide, our path where we're at now with peptides. But people with MS, it's full inflammation. And then they get mechanical inflammation because of that. I can't tell you how many people I see with MS that if I ask them, someone labeled them with IBS, irritable bowel syndrome. Why? Because they touch inflammation, it's full of neurons, but no one's taking care of that. Then they're taking the medicine that's making them more constipated.
Exactly.
Whether it's an opioid or, an anticholinergic, they're taking another medicine to help with their pain, but that's causing more of their irritable bowel. But they're in catch-22. They're perfect candidates for that medicine.
Man, you're 100% right. And I also feel one thing cool about the PDPAs is that it seems that it disrupts cytokine-mediated inflammation. So just to give you an example, there was a guy actually, it wasn't done by me, but by another doctor in like the Northeast. And they had this patient who received an infusion IV, and they were trying to use it just for like, I think shoulder pain or something. I don't know exactly why they did IV instead of injecting the shoulder, but they ideally should have injected the shoulder first. But they did just the IV treatment for this patient. I think they were just kind of wanting to test it out. And what was really weird is his ulcerative colitis completely resolved. And he's like, how is this possible? And I think what it really boils down to, and I've seen this a lot with especially the IV infusions, is that if you have a cytokine mediated inflammatory cycle, like for example, like rheumatoid arthritis, where the body attacks the joint, which causes inflammation. The more inflammation recruits more immune cells, which recruits more of an attack. And you kind of have this cycle like this that's going on. It seems like the PDPAs will essentially stop that cytokine-mediated inflammatory cycle and at least reverse it temporarily. For him, for this other guy, like he's been, I think now for a month and a half, had no symptoms. This is one treatment. So there's something to I'm seeing like there's not only just the body inflammation from all the exposure, but it's like they're getting onto these things where like you get inflammation that causes cytokine release, which causes more inflammation, which releases more cytokines, and you get this kind of wheel going like that. And I think that's kind of what's leading to a lot of this chronic disease, you know?
I agree with you. And I tell people, the body doesn't care. We label it. The body doesn't say, oh, well, you got MS, so we only go to the nervous system. Or you got rheumatoid arthritis, they only go to your joints. No, it's inflamed and it'll go anywhere and everywhere because it's in your system. And it's trying to fight off anything and everything, and it's hyperactive. And then it gets fatigued out. And that's what inflammation does to the body. We label it. The body doesn't. And that's what we said. That's why it works for the colitis and why it helps, because it helps everywhere. We wanted to go specifically to the place that's most inflamed. Right. So for that gentleman, he had two major sources of inflammation. One was in his cervical neck, right, which is really affecting twilight, and to his brain. So those are the two major things. And if someone else, like, for example, a lot of your people that are rheumatological problems have peripheral neuropathy, nerve damage at the end of their feet, cold, numbness, painful feet. Well, why is that? Because of what you just said. It's inflammation and just goes there. And then that's research to areas the most distal part of your body, right? So it doesn't get nutrients, doesn't get whatever it needs to get to fight off that inflammation. I think if people understand, listening to you, understanding that, things like an Eastern philosophy, right? The Asian philosophy, that would treat the body as a whole, not just a certain organ, just that they would understand. Would you understand that and come to you makes a big difference because you treat them differently than, the 15-minute rapid fire. Oh, you got this here, take one.
Absolutely. That's the same thing you do. That's why you're so popular. So you got so many people waiting just to get in for headaches. But
yeah, we help. And it's nice to be able to understand this new, technology with this medication, peptide, and how it does help. And yeah, I do. It is, it's not free. Insurance doesn't cover it. But, I thought someone, because so if you were to have, for example, for me, I would have my knee surgery, right? I had to pay for the doctor, the anesthesiologist, the surgery center, the labs, and it still comes out. That still comes out to about $5,000-$6,000.
Yeah.
Your deductible. It still comes out to that. Now, don't forget the rehab and fix that, and lost work time. You think about all that. People think, oh my God, it's expensive. But if you think of the alternative, get the quality of life just financially, it makes more sense.
It does. And that's what I see for a lot of patients that come to me, is because there's a lot of the people that I see that are, like they'll be like high level executives where they might be paid on some kind of bonus structure. I'm thinking like, we have a few guys that are in the oil industry that are like, I think they're like senior vice presidents. And for them, they're explaining to me like most of their salary is actually generated by their bonus. So they can hit certain like milestones that are given to them, then they get this bonus. If they don't get the bonus. And so, for them, it's so important that they're able to deliver this result, because like, it's like a 60% pay difference, so it's like a huge difference, for them personally. And so they're like I can't have shoulder surgery and I can't be out in rehab for 6 months. I can't be doing this stuff because I need to focus on getting, winning this thing so I can get my bonus, right? And so just like the ability to help treat them and get them back out is huge. Obviously, that's why the athletes do it too. Because, for athletes, if you have a multi-million-dollar NFL contract, what isn't worth it to keep that, Yeah. And so I think that there are special case examples where like the product itself, while it is expensive, makes sense, especially for people that are high functioning. If you're somebody who's, running a big business, if you're somebody who's an athlete, somebody who's, everything from that to even people that are, success. Like if you're a mom and you're caring for 3 kids, do you really have time to go to rehab for your shoulder and be down for that long? I would be down. I would be down for, it's still, what am I going to do? So even
You don't have to be the high-powered executive, but that's work. The sole businessman, the guy who runs his own plumber, the guy who runs a construction, he doesn't have that time.
That's true.
But, everyone does. And like I said, the mom's down, the dad can't work if the mom's staying her mom. I mean, it's such a quality of life. And what it really is changed. It's phenomenal. I mean, as a doctor, reading what it does and that it changes. It actually changes. We're not treating it. We're not band-aiding it. We're not treating a symptom. We're actually changing the pathophysiology. We're making a difference. This medicine actually changes your dynamics. If you're diabetic, you got neuropathy, you risk your heart attack. You're reversing that process. It may not be permanent, but instead of being advanced, you're now in the mild phase. You know what that means?
It's huge.
It's actually changing it.
Exactly.
We're not just saying, we're not, okay, fix the shoulder and off you go. You would really change the dynamics of your health.
You really bring,
that's
yeah, that's a huge point. And I didn't realize it until you said that, but I started to think back and it's like, how many times have you seen someone, especially people that get older, where they start to get a little bit of illness, it essentially goes untreated, or they just give a whole bunch of medications for it. And, basically like you might have an older woman and she starts to have, headaches, and maybe she gets inner ear problem. Now she's a little dizzy. Then she falls. Now she gets a broken hip. The broken hip has to get emergency repaired. And now she's in the hospital. She's not moving. Then she gets a blood clot. And it's just like, you can almost watch, like just these little shifts in the way that the disease states start. Like just one little thing. Like if she didn't have her inner ear problem, she wouldn't have fallen down, which, wouldn't have led to the hip fracture, which wouldn't lead to the blood clot, which wouldn't have led to her to get sepsis. It's like, you could just you could find these things. So I think you're right, like catching it early and shifting that dynamic away from, a progressive disease state to something where you are actually re-enabling your body, giving your body the ability to regenerate its own tissues. That's huge,
I mean, we read this and we see it. I mean, we share articles.
Yeah.
And it's like, it does that. That's what gets me excited. It actually does that we're changing inflammation. We're getting rid of inflammation. And, how long, like I said, to someone who has traumatic brain injury or someone who has dementia, for example, the patient I had, the quality of life, even that someone goes from mild to moderate in Alzheimer's, it's the first few years. And if you look at the graph, the first few years, forgetfulness were my keys. And then you look at the graph and it goes down like that because we have no more functional reserve in our brains to compensate. So the year, like by year 3, 4, 5, and it goes down like this to the year 10 and then end of life basically the last few years. So if you can get someone here, the differences between there and there, $40,000 a year, $50,000 a year, putting someone in a nursing home. What does that cost? I mean, that is huge. I used to talk to doctors about, I don't want to give this medication because it's only 7% benefit. I said, you have $40,000 in your pocket? You go, why don't? Well, that 7% difference could be the difference between someone being mild to moderate severe down here, from being functional to being totally dependent and needing aid or having been in a nursing home. To you, it's not big deal. To this, we don't, sometimes we doctors forget. We read the data and saying, okay, 7% is not that big a deal. I don't want to spend that. It's not worth it. Right. But to a person, it's a huge deal. So if we can get them early, diabetes, right? We can help them lose weight, with the peptides. And now they're not at risk for a heart attack, stroke, disabilities, let alone the cost of medications, right? I mean, if we can get them early, we can teach people to recognize there's problems with their health before. As I said, don't wait to treat a heart attack. Don't wait to have a heart attack to treat your heart. Don't wait to have Alzheimer's and dementia, memory loss to treat your brain. Or, be prevent. Prevent that with your car. You pay car insurance. You pay homeowner insurance. Why? Why did you accept your roof? So it doesn't leak and doesn't fly. Why don't you do that with your health?
Exactly. That's so true. And often people put themselves last, and so that's a really good point. I'd be curious to see, as you might have, I'm sure you've seen that basically now they say that, the type 3 diabetes is, related to dementia, right? Or they call dementia the type 3 diabetes now. Could you maybe talk a little bit more about that and what that means to an average person?
Well, like we were just talking, some diabetes, right? How does that, it affects your blood flow, right? And the blood-brain barrier, blood between the brain and rest of the body is very different than the bloodstream and the blood flow to the liver or the kidney, because it has to be more selective. So if there's problems, the diabetics make you more prone to having these plaques. And these plaques can cause hardening of the arteries, cause stenosis. Now, but it also can prevent the way the body responds to the nutrients, the way the brain gets its nutrients. So now that's not being affected. It's not being affected properly. So now you have two different mechanisms why you're going to get memory loss. One could be stuff like what we call sudden heart attacks. You get sudden little strokes. You see that on the MRI. You see these little white spots. So what is that? That means your end vessels are being damaged, or you may not know part of it. So circulatory wise, the diabetes is causing this damage, but it's also causing more protein damage because it's not allowing blood vessels clear breach from the brain. Brain also has to clear out its own system. Its own lymphatic system needs to clean that out. If they can't do that because the arteries are not functioning well because of the diabetes, it builds up these plaque formations, which will then potentially lead to more bad and Alzheimer's. So Alzheimer's is the most common cause of dementia, memory loss. The second most is vascular and Alzheimer's. What's the most common cause of vascular disease? Diabetes. And as we all know, as I'm sure you said, we've told these, your people before, they told, the people, that diabetes, right, leads to high cholesterol, right? All the cardiologists say, if you're diabetic, you must be on cholesterol, even if your cholesterol levels are normal. Why is it? Because it builds up inflammation. So that's why diabetes does a lot of things. And for dementia, it causes two different ways. So it accelerates the risk for it.
Yeah, that's awesome. And thank you so much for clarifying that, because I think it's an area that a lot of people have questions about, and especially I don't think the public is 100% aware, because, the common, like if you have to ask the common person on the street, like, your mom has Alzheimer's, like, what is it that caused that? And like, oh, I don't know. It just happened to her. They're unaware that there's like a causal relationship at all. And so I think it's so important to educate people on that.
Well, the last thing I want to tell you is that even beyond peptides is where you probably tell people in general health, eat healthy, mental exercise, physical exercise, socialize, be involved in the community. Those are things people tend to forget, but they need to do.
This is very true. And I think the community aspect is really critical, which kind of goes back to the initial story about the guy with the pickleball, because I've seen so many times for people, especially people that are kind of more towards retirement, that they're like, maybe their access to their community is through sports like pickleball or through a social club or something like this. And they'll get some kind of disease state that separates them from that ability. And man, it ruins their life. Like, they're not hanging out with their friends anymore. They don't have any social interaction. They're isolated by themselves. So they get depressed, and it's just a downward spiral. So the ability to get people up and able to participate in those activities is not just for the activity themselves, but many times for all the other benefits they bring,
Right. And that's what I tell them. I go, look, don't look at it as a one-time deal, financial cost. This is a lifetime treatment. It's like, yeah, you have to pay, you have to pay one time, but if you exponentially bring it out over a couple of years, it's not that expensive. And the quality of life, your better medical health, better social health, and mental health. I mean, people forget that you're right. They put themselves last. They realize they have to put themselves first. It's not being selfish.
So true. And then, one of the things that I think that would be wise is if I'm because you're in Plantation, Florida, which is basically kind of like South Florida area, right? It's kind of like near Fort Lauderdale and Miami, just for people that are maybe not specific to that area. There's a lot of people that need help with headaches, that need help with your cognitive function. Just like you mentioned before, that gentleman who's, a high functioning accountant, and now had word stuttering and he had pain in his neck, and you were able to reverse all of those. How would somebody who has those reach out to you and say, hey, can I also come to you, or am I a good case for you to work on?
They can go to my website, the Headache and Pain Center, South Florida.
Okay.
And my office number is 954-900-6699.
Okay, perfect. Thank you. And then just to make sure we got the website, is it all one word, headache?
The Headache and Pain Center, South Florida.
Okay. All right. So they go to this website to reach out to you, and then they can basically just go to contact us and send you a message if there's somebody who, has the issues and want to get treated with this new technology, or if they have, they need somebody to help with, cognitive function, headaches. This is the best place for them to go, right?
I believe so.
I believe so too. So if you're somebody who suffers that, Dr. Steinberg is a genius and a very wise guy. He's very humble, as you can probably see. But if my father had issues with mentation, I would 100% tell him to go to Dr. Steinberg, 100%. So he's an amazing physician. No, it's really true. And what I love the best about it is that you have a holistic approach. You're not just like, and I hate to say this because I understand a little bit why it happens economically, but with a level 1 Medicare visit paying $20 total, like that's not profit, that's total. You got to pay your staff, your light bill, your malpractice, your office rent, everything, out of that $20. That's why medicine is the way it is, because, with such low reimbursements, you're just, hey, I got to move, people through as fast as possible. And this is the traditional mainstream medicine experience. With Dr. Steinberg, you will not have a traditional mainstream experience because he actually cares. And he actually will figure out what's wrong. And I think in the neurology world, I'm anesthesia, pain, and addiction medicine. So I treat a lot of people with pain and interventional procedures. And one of the things that I always found difficult was to find a really good neurologist. And Dr. Steinberg is the best neurologist that I've ever worked with. So if that means anything to you, if you have any of these issues, reach out to Dr. Steinberg. He's an amazing physician and a good friend. And also has, he doesn't only practice these things, he uses them on himself. He used PDPA on himself to actually heal his knee. So, he's actually using the things that he's treating with himself. So he's proof of he's drinking the Kool-Aid, or he's the proof in the pudding, right?
Yeah. Proudly.
Well, awesome. Thank you so much for coming on the podcast, Dr. Steinberg. It's an honor to have you. And we look forward to having you in the future as well.
It's been a pleasure to come back and talk some more. Thank you so much for having me. I really appreciate it.
Oh, my pleasure.